Well, new on AM Extra, July is National Minority Mental Health Awareness Month.
It is meant to bring awareness to the unique struggles facing racial and ethnic minorities in the U.S. And joining us live with more is Reverend Markel Hutchins, President and CEO of Movement Forward. Good morning.
Good morning. It's great to be with you.
Yeah, thanks for being here. First of all, tell us about Movement Forward. What does that do?
Movement Forward is a solution-focused human and civil rights organization that we created 6 or 7 years ago to continue the work of building the beloved community envisioned by Dr. Martin Luther King Jr. I was very fortunate, Ken, to be mentored by most of the civil rights icons that worked very closely with Dr. King, including his wife, Mrs. Coretta Scott King, and most others. So we take the work of that tradition, that lineage, that legacy, and move it forward into new generations and cooperative spaces.
So when we dig into the issue of minority mental health and we look at some of the research, we're finding that there are some unique mental health challenges and struggles for minorities, while at the same time, some other issues with access to mental health care. Talk a little bit about some of these issues and what's being done about it.
Well, there are a number of contributing factors that have caused African Americans to lag behind the majority of the American people in terms of access and openness to be recipients of mental health treatment and care. One of those collaborating or one of those factors is certainly access. Minorities don't have the same kind of health care coverage that other Americans, particularly white Americans, have. So the cost and the access of ability to be able to afford mental health treatment is one of those factors. But then there's also some psychological and sociological contributors. Number one, people of color have unfortunately dealt with for many decades the stigma that somehow you're weak or you're not as strong as others if you have to seek mental health support and mental health treatment. So I think what we're dealing with now is both a sociological and an economic challenge that creates this kind of disparity in support and treatment for people in minority communities that perhaps should receive mental health care.
Yeah, when you talk about access, is it just a matter of money or is it a matter of being able to find those professionals who can deal with your problem?
Well, I think it's both. I think it's a matter of economics because, again, I think that the data shows that African Americans, Hispanics, and other ethnic minorities don't have the same level of income and the level of access to the quality of economics that the majority or white Americans have. So that is one factor. But then also, there's probably a significant deficit of sensitivity to the particularities of the conditions that African Americans and Hispanics and other minorities face in America. There's no race of people in the history of our country who have been as disenfranchised and depressed and oppressed as African Americans. So the trauma that Black Americans face is unique, and it takes a unique kind of mental health professional to understand the dynamics, that understand the history, that could then be able to diagnose and effectively treat people, particularly in the African American community. So I think it's both. I think there's an access economically, but there's also a deficit of those that have the sensitivity and the training to be able to address the particularities of the conditions that face some of our nation's minority communities.
That's a really great point. So in looking at that then, what is being done to change that? Obviously, there has to be kind of a multifaceted approach here.
Well, I think things like this particular month, raising the conversation, raising the issue, being able to openly discuss in a non-shameful format, in a popular media format like this and on social media, having these discussions about the need, lessening the shame, lessening the stigma is probably the greatest thing that we can do to really address these matters. There's an enormous push from the federal government, and I think in states across this country to place more emphasis on providing access to quality and effective mental health care for people across our country. I think that's happening in Oregon, it's happening in states across the country. But I think if we continue to push We will continue to see improvements in this area, but it will not happen until everyday citizens and everyday communities have these conversations, and not just in minority communities. All of us should be having conversations at our dinner table, at our breakfast table, about how important it is to maintain a healthy mind, a healthy psychosis, a healthy mentality, because only when we do so will we see a decline in some of the mental health challenges that we've seen over the last several decades.
Reverend Hutchins, thank you for joining us on AM Extra. We appreciate you talking about this important topic.
Good to be with you.
And for more information, go to movementforward.org. 7